Just days before the gavel comes down to begin the 2020 legislative session, Governor Kevin Stitt unveils his alternative plan to Medicaid expansion. ONR's Jason Doyle has a reaction from both sides of the aisle.
Governor Stitt is calling his health care plan Sooner Care 2.0. He announced his proposal in Washington, D.C. alongside officials with the Centers of Medicare and Medicaid Services, or CMS, who unveiled a plan of their own, the Healthy Adults Opportunity Program, which utilizes block grants to expand Medicaid access to the working poor. While the governor was in Washington, D.C., he called into this week's Associated Press Legislative Forum.
We're real excited. We were the only state there. The senator from Louisiana was there as well, but we're really excited to partner on this Healthy Adult Opportunity Program and reimagine to become top 10 in health outcomes in Oklahoma.
Sooner Care 2.0 will require eligible participants to pay a small premium.
We're really excited about designing it along with the Trump administration to require premiums or skin in the game, and also some community engagement or education or work requirements for this adult population that are just the working poor.
Stitt says Oklahoma stands to receive an additional $1 billion in block grant funding. Block grants are designed to give states more power to decide how that money is spent. The governor's plan stands in opposition to State Question 802, which will be voted on sometime in 2020.
Frankly, I think it's too little too late. It seems like a desperate attempt to head off what it looks like the voters will approve.
State Question 802 proposes a traditional Medicaid expansion under the Affordable Care Act, which Virgin says is superior to the governor's plan.
And we know a lot about block grants. We've been through this discussion before, but there are a lot of negatives for block grants when it comes to the people who actually need the treatment under the system. We don't know the details of what the governor is proposing, and that's unfortunate that legislative leaders haven't been briefed on this on either side of the aisle.
Stitt does have the early support of Republican leaders.
I'm very excited about the opportunities that are going to be afforded the states, and that's going to help us in terms of addressing health care, I think, in a better way for Oklahomans.
I'm still digging into what the Trump component of the Healthy Adults provision that was rolled out today. I'm excited that we're trying to take our destiny into our own hands of not just allowing the Medicaid expansion carte blanche to be in the Constitution, but trying to come up with an Oklahoma plan that's customized.
Unlike Representative Virgin, Senate Minority Leader Kay Floyd is taking a wait-and-see approach to Sooner Care 2.0.
We're open to looking at anything he presents. I would have preferred that we had it a little bit sooner rather than later, but it is what it is. So we're going to look at it, we're going to digest it, we're going to check the numbers. It sounds like it's a plan that's not been used in any other state. I think that because we don't have a prototype in other states, that we really need to do a deep dive and look and see. I don't mind us being first in things, but something this big, I'd feel a little bit better if we had some other states that had learned from their mistakes so we wouldn't have to, but we'll do what we need to do.
There are several steps the Stitt administration must undertake to make Sooner Care 2.0 reality in Oklahoma. In the meantime, Stitt is required to put State Question 802 on either the June or November ballot. Its passage would put many of the ideas in his plan in jeopardy.
That's exactly why I'm out leading on this, because it would be disastrous to our state if it passed. But you're exactly right. If it passed, then we would not be able to take advantage of any of these waivers and different ways to administer health care in Oklahoma, like the Trump administration is saying.
Jason Doyle, the Oklahoma News Report.
Now, the governor says he will provide more details on his Medicaid plan during his State of the State address on Monday. And OETA will carry that address live with our coverage beginning at 12:30.